Hi, my name's Adam Critchley. I'm a consultant breast surgeon, work in the Royal Victoria Infirmary in Newcastle and Tyne, and I've been a consultant since 2013. Today I'd like to talk to you about cosmetic breast surgery. I see patients privately at the Newcastle Hospital in Jesmond, and I've been seeing private patients for cosmetic surgery since 2016. It's a huge topic and applies to lots of women who are unhappy with their breasts for a number of reasons, and this can be because they feel the breasts are out of proportion to their body, typically because they're too large, and a lot of patients are interested in talking about breast reduction. Some patients feel that the breasts have just dropped over time, maybe because they had children and breastfed, or simply because they've lost a bit of weight. And this can affect patients' body image and body confidence in lots of different ways. And these types of patients are often suitable for a breast lift. And the scientific term for that is a mastopexy. Some patients feel that their breasts are too small for their frame. And in this instance, then they may well be suitable for a breast augmentation. And typically in that situation, I would use silicone breast implants placed behind the breast, either on top or behind the chest wall muscles, to give the patients a fuller breast appearance, more fullness in the upper pole, more projection of the nipple, and obviously trying to enhance their overall day-to-day confidence and body image. Typically I see patients in clinic for at least 40 to 60 minutes, and often see patients for a repeat consultation just to clarify the plan and take them through the written consent form ahead of the surgery. On the day of the surgery, you'll be admitted to the ward at the Newcastle Hospital, and then I will come and retake your consent, confirm the consent, and then spend some time making some detailed measurements and markings ahead of the surgery, so that I can be happy that I'm going to deliver the best possible results for you. You'll also be seen by the consultant anaesthetist on the day of the surgery, and they'll take you through what's involved with the general anaesthetic, and also talk you through what's involved with ultrasound guided nerve blocks, which I use routinely so that patients have the best possible post-operative pain relief. You will then be taken down to the breast theatre in the Newcastle Hospital, which has the latest technology and excellent theatre staff, and you'll be put to sleep, and that's the last that you will know about things until you wake up a few hours later. The length of surgery varies depending on the type of surgery you have. Most procedures take at least an hour, and some procedures take up to 3 hours. But whether it's 1, 2 or 3 hours, you'll have very little, or you'll have no awareness of how long it's taken until you wake up in recovery. Most of my patients are extremely comfortable in recovery. The nerve blocks that I mentioned earlier are typically extremely effective, giving fantastic pain relief for 18 to 24 hours following the surgery. And as I explained to patients in clinic, the important thing is to get you off to a really good start with pain relief, because it's rare that you go backwards. I often operate on a Thursday afternoon in the Newcastle Hospital. I then come and see you the first thing the following morning to check that you're recovering well and there are no early post-operative issues. You will then be discharged home later the same morning, and the vast majority of my patients don't need surgical drains. You'll go home with dissolvable sutures, waterproof dressings, and a supportive bra as needed. You will have detailed aftercare instructions and contact details for how to get back in touch with the ward if you have any concerns whatsoever, and they will contact me immediately, and I will be available to come and see you and make you feel reassured and address any issues that there are. Following discharge, patients come back 8 days following surgery to the treatment room to have the dressings removed and all of the wounds checked, and usually I'm in my clinic at that time, and I pop across and check that you're doing as I expect, and answer any questions that you have at that stage. You will then come back and see me the following week in my clinic, where again I'll remove the dressings, typically for the final time, and just check that everything's healing as I would expect. By that point, most patients are more than fit to return to work. I've had patients after breast reduction who've gone to see Bruce Springsteen 8 days after their surgery. Some patients are ready to work from home almost immediately, and most patients are surprised with the level of pain relief that they have following the surgery, so they have very little in the way of physical restriction or pain that would prevent them from undertaking everyday tasks. Ultimately, I want your life to return to normal as soon as possible following the surgery, and we do everything that we can to make sure that you have an excellent and enhanced recovery so that you get back to normal as soon as possible. If you'd like to know about any more of the aspects of breast surgery that I've discussed today, then please visit my website www.newcastlebreastsurgeon.com. It's full of detail. There's lots of photos covering all the different procedures that I perform, and they're all patients of mine before and after surgery. There's also a very detailed blog section that contains information about all of the individual procedures, recovery from surgery and aftercare,